had some pain on passing urine. They gave him treatment, and then they did a scan and they found out his prostate was enlarged. Now, if the problem is the prostate, this is actually what happens. You know, this is the bladder, the urine bladder here, and so the urine bladder empties into the penis through a channel here we call urethra, and the prostate is around the upper part of this channel.
Okay.
Yes. Now, when the prostate enlarges, it squeezes this. It squeezes and sort of blocks.
That tube blocks.
Yes. So it becomes hard to empty the bladder, and you have to squeeze to make the urine come out. That can pain, or infections can start setting here because
of course the urine is not passing out.
The urine is not coming out at all. So that can be a disturbance.
Okay.
Now, there are different treatments they do give. Some people, if they find out the enlargement of the prostate is not so much, they give some antibiotics to make the prostate infection to go off, and then the channel becomes okay. Others, they give medicines to suppress the enlargement of the prostate.
Okay.
Yeah.
Thank you.
Now, but if any particular treatment is not working well, he must go back
and seek better medical checkup.
Yes.
Thank you so much, Doctor. You have other questions here. Yes. Dear Doctor, I have two questions. One, what causes retrograde ejaculation? Okay. Two, is there a link with male infertility? Is there a link with male infertility with witchcraft? Something like that, Sam.
Okay. Yes, so he's asking about retrograde ejaculation. Now, we can use this same thing here to illustrate. Now, this is where sperm is made and stored here a little bit and pushed through this channel when it is supposed to be released, moves through here and joins another channel here and eventually joins another channel which it shares with the urine. Yes. So that's how it's done. Now, at these junctions here, you can see this part is shared, but this is not shared and that's not shared. So there's a gate here, there's a gate here, there's a gate here. Yes. So during the passage of urine, this gate is closed for the sperm. Okay. It's only the urine gate which is removed, opened. Okay. Yes. During the passage of sperms, the urine gate is closed, and it passes. This one only is using. Okay. Okay. Yeah. So, in retrograde ejaculation, what happens is instead of the sperm passing here through here and using this channel to come this way, there's an obstruction here, and from here the sperm goes up. Goes back to where it's to the urine. To be. Yes. So it is a problem of these junctions here, and the muscles, the valves which control the muscles, the sphincters which control this, and these are very tightly regulated by the nervous system. Okay. Yeah. So if you have problems with the weakness of those muscles, or if you have a problem, and that weakness happens in people who have like diabetes, or people who have trauma to this area. Yes, like during prostate surgery. Now, when they're doing prostate surgery, they remove the whole of this gland, and you can see all these muscles go. Now, everything pours into a space, and so it is easy for it to go that way. That's why we usually advise people who are going to do prostate surgery, if they think in future they may want to have babies, they should have the sperms kept first, because this may become a problem. Thank you so much, Doctor. Yes. I think you've got the explanation very well, Sam. This is, someone is saying, Kennedy, what happens if you stop masturbation? I think if you stop masturbation. Yes, yes. So if you, the problem of masturbation is it conditions your brain to be static to something that is not supposed to be. Exactly. It conditions your brain to the stimulation with your hands of your genital system. You know, yes. So if you can remove, you can get control of your mind and you stop masturbation, your system will go back to the norm. Okay. It will go back to the norm, and you get back to normal. Yes. He's actually saying, can you go back to the way you were before? I think yes, you go back to how you were, Kennedy. Yes. Thanks so much, Kennedy. Doctor, please, when are you discussing vaginal dryness? That will be another topic. Thank you so much. Hello, Bethan TV. Yes, my name is Peter from Mutungo. I have a friend who used masturbation for some good time, but he has failed to have a child for a year. Could it be the problem? Thank you so much for the teaching.
Yes, this is Peter from Mutungo.
Yeah, most likely that could be the cause. Most likely, and he definitely needs help.
Okay.
You can encourage him to come over, and we see how to help him. Yeah.
Thank you so much. I think you've got the answer, Peter. Kindly encourage your friend to go to the hospital for better medical examination. Someone is saying, what is the importance of prostate and what causes prostate cancer? Balambula Titus. Thank you, Titus.
Yes, what's the importance of the prostate? Yes, so prostate is this gland here.
Okay.
God put it right at this junction here. It produces some secretions which help, it mixes, actually the secretions mix with the sperm as they pass. Now, those secretions, they help, you know, when the sperm is, the semen, which contains the sperm, is delivered into the vaginal canal during the time of intercourse. It clots. It actually doesn't remain like water. It immediately turns into like a gel. Okay. And that helps it to stick on the cervix so that the sperms, which are good, can swim into the cervix. Otherwise, if it remained liquid, it will all pour away and it will cause infertility. Okay. Yes. Okay. So the prostate is very, so then after that gel is formed, after the sperms have gone, it has to become liquid again so that it can now move away. Now the prostate produces secretions which cause these changes in the texture of the sperms, of the semen, when it is being delivered. Yeah. So don't confuse yourself, but it produces some substances which is added to the semen so that the semen is able to deliver the sperm very well. Okay. Yes. Otherwise, without the prostate, it can even cause infertility.
Thank you so much, Doctor. I think you've got that explanation from Doctor. Thank you, Balambula Titus. We have another one, Jasper. He's saying, I'm 25 years old. My issue is my right side testis pains me at times. Not every time, but it's been there for now 7 years. Wow. The right side of the testicle. Of the testis pains, yes. It's now 7 years. 7 years, yes. So he definitely needs a thorough examination because painful testicle can be because of a chronic infection, or can be as a result of maybe a scar in the testicle or in the scrotum. Sometimes these things can have an implication on your fertility as well, but also can be a sign of some swellings within that area. So that area is very complex. You cannot sit down when there's pain there. True. Please seek advice. Seek advice and make sure the doctor. You need examination. They can do a lot of things, including scan examination. It needs to be sorted out.